So today is a very exciting day for us. It's World Hearing Day 2022 and we are launching a new community-based audiology service in Grassy Park in Cape Town. This project, entitled #HearItTogether, is a collaboration between us here in Africa, the implementers on the ground, the audiologists in the field, with WSA, a hearing aid company. We've also partnered with LOFOB, which stands for the League of the Friends of the Blind, and they are a local NGO based here in Grassy Park, as well as our first GP practice, of which we hope there will be more. But the GP practice we're working with is Dr. Ryan Chalwell and Dr. Rhoda Conrad.
Well, I think hearing is very important, especially in this community. There isn't a lot of access to good audiology or hearing aids because of the cost factor, and this is a great opportunity for our patients and for the people in the area to get access to that.
This program is so unique because it bridges the gap between the private sector and the public healthcare sector. It's the middle ground, and this has never been done before, so we're creating accessibility to hearing healthcare.
The launch of this today is part of a dream that I've had for a very long time, to improve the accessibility of hearing healthcare services to all communities.
I feel very out of place when I am with people, and especially when we have a gathering and I can't hear, and I'm very frustrated because I don't know what they're saying. I don't even go to church because I can't even hear what the minister say from the pulpit, and it's very frustrating now. What is the sense of going there? But I know if there is people now that go through this screening, the word will go round and people will get to know about you people.
The testing is so quick. It's a very easy thing for us to add on to a consultation that the patient otherwise, they usually wouldn't have come to see us for that specific problem, but we might pick them up while they're here for other issues, especially general checkups and chronic follow-up patients.
LOFOB is the League of the Friends of the Blind and is an NGO based here in Grassy Park. It's been here for decades. It's very well known, very well trusted by the community. And I've always had a thought in my mind that we shouldn't always just focus on the ears. We should look at the eyes, the ears, and anything else that we can do while we're in the community, reaching out to people. And so LOFOB has very kindly offered us a room to use here in their building, and we are very excited that today we will start off by testing some of the residents who live here. We are coming into communities and looking for people who we know are staying at home and not coming to audiologists, possibly because they don't know what an audiologist is and they don't know what we do.
Actually, to be very honest, I've never ever thought about audiologists. Ophthalmologists, yes, but never audiologists. And I'm like, but after today, I will definitely recommend.
So we're excited about changing the awareness around that, but also for people to realize that hearing aids are within their reach and they're not a luxury item, they are a right.
So as an audiologist, I'm gaining far more insight as to what accessibility is all about and what the needs of people are that have hearing loss and hearing problems, and how we as audiologists can meet those needs. Engaging with lots of the community members, we ask them many questions about what they actually need and how we can best serve and provide best quality care for them.
It's very sad for me as an audiologist who's been in practice for over 20 years and has loved working in South Africa to hear that so many South African audiologists are graduating and going overseas. We're really hoping to create jobs and exciting positions for new graduates and young audiologists who are looking for something more dynamic within their career.
It is a very humbling experience working in Grassy Park. Many people have contacted us for appointments on the verge of tears, being so grateful that the services have come to their communities. Often people with hearing loss don't know where to go, and now we've provided them with a safe space in their community of where to access free hearing screening assessments, hearing tests, and affordable hearing aids.
An exciting aspect about this project is the collaboration between an audiology organisation and a hearing aid company. And I'm so grateful for WSA offering to work on this project with us, because it's exactly what's been needed. We need to work together to share what's happening on the ground, and for them to then use that in their development of technology and hearing aids. It shouldn't matter whether you are rich or poor, the colour of your skin, your age. You have the right to be able to access hearing healthcare services. And so my vision, not only for South Africa and this continent of Africa, but also for any low and middle income communities where we know the majority of people with hearing loss are living, is that they should have access to high quality hearing healthcare services and affordable hearing aids.
I'm just going to switch them on now.
All right.
Yes.
All right, how's that sounding to you?
Yeah.
Different?
I just feel like a small child.